Hi, Dr. Todd Snyder again. Now, this is episode 4, where we're going to be discussing smile design principles using 1:2 magnification non-retracted smile photographs, a lot like this one here. Now, I use these to evaluate position of the teeth within the smile. Now, I'm looking at multiple points for harmony in the smile from left to right, which are noted by the curved lines and dots across the whole smile in this photograph. Okay. Now, I'm looking at the proportions of the teeth, the length-to-width ratios, the golden proportions, and the angulation. Now I look to see if there's crowding, are there angulation or rotational issues? We can also visualize the midline easily to determine if teeth need to be moved prior to treatment, or if they can be visually moved using restorative dental procedures. Now we can also evaluate the smile line of the lower lip to see if it's in harmony with the incisal plane of the teeth. I then look at the incisal edge position of the teeth. Do the teeth touch the lip? Do they follow closely the smile line of the lip? Or do I have to add space or length to a worn dentition? If they have incisal wear, have the teeth super erupted? And if they have, how does that impact the gingival display? Are we showing more gum tissue because of it? And how much length of the tooth shows at rest? All of these come into question of where to position the teeth, which is based off the central incisors. So in looking at the teeth, we want to make sure that the teeth are in a proper position. So we're taking a big look at things to see where the teeth are and how much gum is displayed. And if we're going to be lengthening teeth, then how does that fit into the smile as far as the framing? And do we need to move the teeth up or keep them where they're at? Or by adding length, are the teeth too long? So we're looking at all of these. So again, having to potentially change the length of teeth, change the incisal edge position. Do I need to intrude teeth or remove gum tissue? At the same time, I'm looking once again at tissue display based on where the incisal edge of the tooth needs to be in relationship to ideal overall tooth lengths. So if we had a normal length central incisor of somewhere between 10 to 12 millimeters, or averaging, let's say, 11.2 millimeters, well, I want about 0 to 4 millimeters of tissue displayed. Now, if I don't, then does the tooth need to be moved or altered? Or do the gums need to be moved? Or both? And so in looking at smiles, we're looking to see how much gum display is present. We're looking at where the central incisors are. We're looking at rotational aspects as well as angulation. Right? And so based on all of these, we can determine where teeth are and where we need to go. Now another photo we can take is obviously this image at about a 45-degree angle, which also shows us where teeth are positioned. Now, based on skeletal position of the bone in relationship to the lips and position of the teeth, do the teeth fill the whole smile? Or do we have some type of deficiencies? Or do we have darkness, let's say, in the corners of the mouth that I can't fill in? There's only so much we can do. So again, the buccal corridor. When we're looking from the front and from the side, do we have the ability to change the buccal corridor? Can we fill it in more? Do we have the ability to maybe do no prep designs where we can just add veneers to add bulk to the tooth to make it look like it's filled the entire smile? There's only so much you can go based on skeletal position, but can we modify that to give someone a fuller smile so we don't have this dead space or this black area? So again, potentially getting to do some additive dentistry to create a better appearance of a wider smile without having to reduce any tooth structure. Okay? So again, looking from a different angle, we can see tooth position, we can see angulation, we can see lip position. We're looking at all of these to assess the overall appearance. And should we like this, we can move forward. Should we want to move teeth forward, we can see how much room we have. Should the teeth already be too far forward, then we recognize we have to move things back. So based on all of these items and more, we can determine where we want to position teeth and what needs to be changed. So that's it for today. Stay tuned for our next episode.